I'm Reed Pence, the host and producer of Radio Health Journal. I recently spoke with investigative reporter Katherine Eband, author of Bottle of Lies, the inside story of the generic drug boom. I asked her about the quality of regulation of generic drugs, even though the vast majority of them are produced on the other side of the world.
What the FDA says is there's exactly the same standards and the same inspections for manufacturing domestically and drug plants overseas. But my reporting really tells a different story.
And that story is?
Well, to inspect a drug plant in the U.S., the FDA just shows up whenever they want. They don't announce it in advance, and they stay as long as they are needed. Overseas, the FDA will actually announce its arrival weeks and sometimes months in advance. And that has given these overseas plants the opportunity to fabricate manufacturing and quality data, to shred documents, to rid plants of insects and birds and lizards in order to put its best foot forward for the FDA. So a number of the sources I've interviewed say those inspections are essentially staged and don't really reflect the quality, the true quality of the plants overseas.
You've even got evidence that some of these plants that they end up inspecting are really fake plants.
That's right. I mean, that happens in China, where actually plants will pool resources and have one show plant that they'll direct investigators to. Because most FDA investigators can't even read the street addresses, they don't know that they're inspecting the same plant over and over again.
And the result is, the one would think, lots of tainted drugs that aren't as potent as they're supposed to be. What kind of problems are common?
There have been glass particulates in drugs. There has been drugs that are tainted with carcinogens, some of which have been used in the production of liquid rocket fuel. There have been cases of metallic fragments. There are cases of drugs that are not bioequivalent. They don't dissolve the same in the body. So these are some of the problems that have been exposed both through FDA inspections and through my reporting.
You can hear the whole story on Radio Health Journal on your favorite radio station, on Apple Podcasts, Google Play, or Spotify, or at radiohealthjournal.net.